with introducing our next speaker, who is going to come up and share some great knowledge and information and wisdom with us on today. And his name is Dr. Morais Cassell. Okay? He is a behavioral health specialist that is certified by the National Board of Certified Counselors and holds a certificate in pharmacology from Harvard Medical School. Dr. Cassell's counseling experience varies among mental health centers, crisis stabilization units, psychiatric clinics, middle and high school, telemental health, and faith-based communities across Georgia and New York. Dr. Cassell currently provides collaborative care for NAMI, Georgia, where he trains and certifies first responders, such as police officers, school resource officers, clinicians, and more. Dr. Cassell is an Afro-Caribbean American, as he was born in Jamaica, okay? Dr. Cassell is a graduate of Liberty University's master's and PhD programs in the Department of Counselor Education and Family Studies School of Behavioral Sciences. Now, you all, I asked all of the male speakers today to share with me a microaggression that they have heard at some point in their lifetime. We know that they have heard many. Microaggressions are those unintentional or intentional statements that are said that are seen as offensive or insulting to marginalized groups, targeted groups. And this is the microaggression that Dr. Cassell shared with me. He stated that when he was a child and walking with his mother down a street in New York, that a lady came up to them, and this is what this lady said to his mother: "Your son will give you a lot of trouble and end up in prison." So again, this lets us know the type of microaggressions that our men may receive as children and even as adults. Dr. Cassell is going to speak to us this morning the topic of "We Shall Overcome" as it relates to racial equity and empowering our African American men. And also, he's going to speak to us a little about crisis intervention training within our communities. So without further delay, Dr. Cassell, come on up here. We are so excited to have you at this historic symposium and to share all the information and knowledge that you have.
Well, good morning, everyone. What a great honor it is to be a part of this amazing African American male symposium. And we are so honored that we are being led by our amazing host, Dr. Izzy. Can you put your hands together in virtual land? And those of us who are here, thank you for all that you do in helping to shape our community, specifically our males. So we're so grateful. We also want to recognize our host organization, NAMI, the National Alliance of Mental Illness, of course, as many of you know, who is the largest grassroots organization as it relates to mental wellness. So we're so grateful. Also, I want to recognize my fellow colleagues who will be sharing. Listen, we have an amazing lineup of men, and I'm just grateful that I get to even sit near them or my name be connected with these men. So I'm going to share with you on the topic, and I believe we're going to try to put it on the screen. If not, we will move forward. I'm going to share on the topic, "We Shall Overcome: Creating Racial Equity, Empowerment Among African American Men, and Valuing CIT for Law Enforcement." So let's move forward. When I think about creating racial equity and empowering African American men, here's the picture that comes to mind, and I hope you could see that in virtual land. This is the picture that comes to mind: a bowl or a cup of soup. And I want you to kind of lean into that and think about that for a moment. A bowl or a cup of soup. So when I think about racial equity and how we empower African American men, this is how I conceptualize it. This is how I frame it. I think about a bowl or a cup of soup. Here's why I think about it in that aspect. Here's how I frame it using a bowl or a cup of soup. Number one, there's several ingredients that are needed to effectively empower African American men. Can I say it again? There are several ingredients that are needed to effectively empower African American men. Here's another reason why I conceptualize the work that we do in empowering African American males. The second thing is that society can no longer treat the experiences of African American men the way that we treat our preferences for soup. What do you mean by that, Dr. Cassell? Well, as many of you know, if you've ever drunk some soup before, there's some things that you take out, you discard, and you put to the side because it's not appetizing to you. Well, listen, we cannot treat African American men like that, right? The third thing is there are several ingredients or experiences that are needed that, if not addressed, can cause the soup to boil over. Wow, there are several ingredients that if we don't deal with those things, it will cause the soup to boil over. And lastly, here's why I think of racial equity and empowering African American males as a cup of soup. The last thing is this. By taking time to investigate the experiences of African American males, what we're doing is we're saying we affirm African American males. We are saying that African American males are valuable, important, needed, and necessary. So if you would just lean in with me for a moment, if you're an African American male, if you've got an African American male around you, would you just say this with me? Say this with me. I am valuable. I am important. I am needed, and I am necessary. Wow. So let's move forward. Let's talk about the first ingredient really quickly that I want to address in terms of empowering African American males. The first ingredient is this: racial equity. Let's talk about racial equity. What does that mean, racial equity? Well, we're going to put it on the screen for you. I won't read everything, but I want you to lean in. And if you're watching online, I want you to lean in and I want you to think about the one that resonates with you. So look on the screen, and the point that resonates, that connects with you, I want you to highlight that, write that in the chat feature. Those of you who are here, you write that down if you need to, right? So when we talk about racial equity, here's what we mean. Here's what we think about. We first must address this difference between equity and equality. Equality is the assumption that everyone gets the same treatment, chances, resources, etc. When we focus on equality, our ultimate goal is fairness. But here's the key. Equity means that everyone gets what they need to succeed. When we focus on equity, our ultimate goal is justice. Here's the third point, and then I'll move forward. Equity is a solution for addressing imbalanced social systems. Justice can take equity one step further by fixing the systems in a way that leads to a long-time, sustainable, equitable access for generations to come. And I like that. And here's a quote that I'd like to read. The route to achieving equity will not be accomplished through treating everyone equally. It will be achieved by treating everyone justly according to their circumstances. So what's the goal? The goal is really equity and justice. Let's move forward and let's put some pictures on the screen. What does racial equity currently look like for African American males? What does it look like? As you see on the screen, here's the reality. One gets more than is needed, while the other gets less than is needed. Thus, a huge disparity is created. Equality is the assumption that everyone benefits from the same supports. This is considered to be equal treatment. That's what it looks like right now. But here's what African American empowerment really should look like. Go to the next slide. This is what it should look like. It should look like equity and really justice. What's equity? Everyone gets the support that they need, which produces equity. Justice, all three in this picture, reminds us that the game, that we're all in the game, and we get the support that we need because the systems that have been perpetrated are removed, or the barriers are removed. So let's go forward and let's talk about another ingredient as we begin to wrap this up. Let's talk about the ingredient of developing racial equity training or education that's specific to our African American men. So what are we saying here? If we're going to empower our African American males, our men in society, we need effective training. We need intentional training towards our African American men. And I've put something on the screen. I won't read all of this, but I want you to kind of see what's out there currently as it relates to racial equity training. According to the Council for the Accreditation of Counseling and Related Programs, which is called CACREP, they are the accrediting body for master's and doctoral programs in counseling and specialties across the United States. Here's what they have said in terms of a standard as it relates to curriculum in the field of counseling. And I've put some things on there. I won't read all of those, but it's important that we highlight them, that we kind of put them out there. We see things like CACREP says you must talk about multiculturalism. You must talk about social justice. You must talk about the impact of heritage and attitude. You must talk about help-seeking behaviors. You must talk about the impact of spiritual beliefs. So that's what CACREP says. We so appreciate that, but I'd like to respectfully ask. That we consider this question: what is missing as it relates to African American men? What is missing? Go to the next slide. I would like us to consider or suggest, in addition to what CACREP has done, and we're grateful for the standards that's out there. In fact, I graduated from a CACREP program, so I know the value of a CACREP accreditation program, but I'd like to suggest a little bit more, that we consider a few things. Here are a few things, not necessarily in of order or importance. We must consider developing culturally competent clinicians. Let's talk about that. We must talk about content focused on social justice. We must talk about engaging BIPOC clients. We must talk about using data to identify gaps in achievement, opportunities, and attainment. Wow. I would like to suggest that we consider talking about effectively transporting biopsychosocial, spiritual interventions for the BIPOC communities. I would like to suggest that we talk about training in restorative practices. Also, I think we should consider culturally informed interventions. A few more that I'd like for us to consider is the expansion of anti-bias training. Also, I think it's important that we talk about evaluating and accountability. In other words, we've got to inspect what we expect. And of course, here's the big word that we like to share here at NAMI, because it's what we do, advocacy. So I am suggesting, in addition to what CACREP has put forward, that we consider these things. Let's begin to wrap it up, and let's ask the question: what does racial identity empowerment look like for African American men? So when we talk about empowering African American men, what should that look like? Here are some things I'd like for us to consider. If we could put that on the screen. Here are some narratives, some thoughts as we empower African American males. We see you, we hear you, we value you, we mourn with you. You matter, your life matters, your mental health, my mental health matters, and we have your back. I like that. If we're going to empower African American men, that's what it should look like. What does racial identity empowerment look like for African American men? Let's share a few more on the screen. Number one, there needs to be awareness, right? I like to say it this way: we need to treat racially related issues like you treat roaches. What do you mean by that, Dr. Cassell? We've got to turn on the lights right? Roaches function in darkness. So when we turn on the lights, they go scattering, right? That's what we've got to do. We've got to value the African American male experience. And listen, here's the key: it doesn't take away from any other group when we validate African American males. I want to highlight just a few more. I won't read everything because it's on the screen. We also need to make sure that care or make health care more accessible to African American males. And then I want to jump down here to letter H, and I want to highlight that. We want to discourage violence among the next generation of black men by teaching our children how to deal with conflict without resorting to violence. A few more: we must disrupt intra-group conflicts. In other words, the stuff that goes on among us, we've got to disrupt that. We've got to stop the emotional bleeding, and we want to make sure that we don't emotionally bleed on the next generation. That's incumbent on me, that I don't pass on my stuff to the next generation. Of course, we want to educate, equip, and empower African American men to be stakeholders, to be men who sit at the table. And I like what Sheriff says, and also change what happens at the table. Let's wrap up with a few models that we know to be effective in empowering African American males. We want to highlight for you, the Sheriff mentioned it earlier, crisis intervention training model, an amazing model that happens. We could put that on the screen if we are able to. But we want to highlight what are these community models that promote racial equity. Of course, our CIT training, which is a first responder training for police officers. And here are some of the benefits of that, and we want to highlight this. We want to resonate it. I know the value of this. I teach it. I sit with the police officers. Here are the benefits. It provides cultural awareness. It reduces the arrest rates of African American males. In general, African Americans with mental illness. Of course, it improves the officers' attitudes and knowledge about African Americans. The other thing we want to highlight here, it provides police officers with more tools to do their job effectively and efficiently and safely as well. And of course, for me, this is the key. It reduces negative encounters among law enforcement and African American males. The last model I'd like to share that we've seen that works is what's called a triangulation approach. Those of us who've worked in diverse communities, we've seen this approach work. We would like to suggest that as we work with African American males, that we do what's called a triangulation approach. What does that mean? It's a collaborative approach that consists of mental health services, medical care, collaborative care, consultation, school-based counseling, child caregiver interaction, workplace holistic care, and community services. And we've given you a picture of what that looks like. So in other words, if we're going to equip and empower our African American males, we're suggesting that mental health be integrated with the faith-based community. Mental health and the faith-based community be integrated with community services. Let's continue to do what we do in empowering our African American males. We matter, we're needed, we're valuable, and we are important. And I turn it over to you, Dr. Izzy.
All right, wonderful. Wonderful, wonderful. Again, you all, that was Dr. Cassell, Afro-Caribbean American male. We are so grateful to him for sharing all of that wealth of knowledge and wisdom with us about racial equity and CIT and other models and K-CRAP. Just remember, you all, too, if questions come up for you, feel free, if you are tuning in by YouTube Live, to put them in the chat. I do have someone monitoring that.